Medicare Advantage versus Medigap. Hi, David here with MedicareProfs.com, and in this video, the third in a series of 5, we're going to explore the differences between Medicare Advantage and Medigap insurance. But first, let's clear up a misconception. Medicare Advantage is not supplemental insurance. There are some big differences. Medicare is another way to receive your Medicare benefits. There's a misconception that when you have a Medicare Advantage plan, you're no longer in Medicare. This is not the case. A Medigap policy, on the other hand, is supplemental insurance that pays your share of Medicare-covered expenses. There are some similarities between the two plans. When you have a Medicare Advantage plan and you have a Medigap policy, you must have both Parts A and B. Both plans have their initial and/or open enrollment periods, and both are offered from private insurance companies. One of the big differences between the two plans is the underwriting requirements. With the Medicare Advantage plan, there's limited medical underwriting. The only issue really that's going to stop you from getting a Medicare Advantage plan medically is if you have end-stage renal disease. A Medicare supplement, on the other hand, requires medical underwriting when you're not in your open enrollment period or in a guaranteed issue period. If you've had a recent confinement to the hospital, have chronic heart disease, had a stroke, and many other ailments, you're probably not going to qualify for a Medicare supplement. Medicare Advantage plans are available county by county, and benefits and premiums can differ. Most plans usually include Part D. Premiums are generally lower than a Medigap policy. Also, with a Medicare Advantage plan, you'll normally pay deductibles, co-insurance, and co-payments when you receive covered services. With a Medicare supplement, plans are standardized, and comparing plans from one company to the next is easy. Premiums will vary from company to company, and Part D is not included. You'll need to enroll in a standalone Part D plan. Premiums are typically going to be much higher than a Medicare Advantage plan. When you enroll in a Medicare Advantage plan, you're probably going to be required to use a provider network. With a Medicare supplement policy, you're allowed to choose your own provider that accepts Medicare. Coming up in Part 4, who should enroll in Medicare Advantage?